Vanessa, I'm going to start things off here in English by asking you about where we stand with numbers on both cases and vaccinations in the state of Colorado, and specifically in the Hispanic community here in Colorado right now.
Sure, Chris, and all this information is in English and in Spanish in our website. It's covid19.colorado.gov. So we have 1,541 cases reported, 54 new hospital admissions. The state positivity rate is 12.01%. So we have reached now the 2 digits. Let's remember that the goal of the state is 5% or under, and right now we're in 12%. So the state level vaccination in the general population is the 82.52%, people with 1 dose. And in regards to the Hispanic community, we have reached 40.13% with 1 dose. So that's the one that people report the race and ethnicity. But according to the model, we estimate that we have 48.16% of people from the Hispanic community vaccinated. So the message is still the same, Chris. It's to be up to date with the vaccines, also to get treatments if you're sick. So those are pretty much the message for everybody. And as always, the vaccine is the best weapon that we have against COVID and any of the other variants.
Good advice there, Vanessa, and thank you for that. Doctor, I want to go over to you and ask you about your biggest concern with COVID-19 generally right now. What are you seeing in the community and specifically here in Colorado?
Yes, Chris. Well, the first thing is of concern are those numbers that Vanessa is talking about. When a couple of maybe 6 or 8 weeks ago, when we started to monitor these things like weekly in this segment that we're talking right now, we were below the 5%. We were close to 3%, 3.5, 3.7 in 2 months or less. Now this has grown 4 times. We're above 12% right now. And this is with the people who are tested on the sites that report to CDPHE, because we have to remember that a lot of people are testing in their homes and are not reporting. So the first thing is that we know that the virus is spreading fast. The other thing that we know is that we have relaxed our behaviors with regards of social distancing and mask wearing. I would really like to tell people that even if it's not required, it would be a good practice to use your face mask when you enter a place that is crowded with people that you don't know. Now we are monitoring a new or a subvariant, BA2.12.1, that is spreading fastly in Europe. And remember that whatever happens in Europe will happen a couple of weeks later here in the United States. So this new variant or this subvariant is spreads more easily than Omicron. So if we have 40% of the people in the Hispanic population, they only have 1 dose, that we don't know how many of them are completely vaccinated, but we know that they are vulnerable to get infected with this subvariant.
Anything else you can tell us about this subvariant and how it spreads? You mentioned that it spreads quicker than Omicron, for example.
Yeah, this subvariant has the capacity to infect even those who have up-to-date vaccine status, or who even were previously infected with COVID. And we also know that if we relax those social distancing and masks that we were saying, it's just going to spread more easily. Fortunately, the number of hospitalizations or deaths has not risen as much as the number of cases. And that is perhaps because in Europe, they have high rates of vaccination in all the communities. So it's really concerning to see that we are talking to a community that is perhaps 70% globally vaccinated, but there's still a group of people who are not. In the Hispanic population, this is a little bit more worrisome.
Finally, what do you expect? I know this is a difficult question, but what do you expect in terms of case numbers as we get into the summer months?
They're going to increase. They're going to increase importantly, just because we have that relaxation in our behavior, and also people are gathering a lot, swimming pools, parties, games. So there's going to be an increase. Hopefully, people will realize that if they're vaccinated, the risk for them of going to the hospital is lower than if they're not vaccinated.
Well, once more, we appreciate having both you, Vanessa, and you, Dr. Ricardo González-Fisher, for a few minutes here to discuss COVID-19 in the Hispanic community here in Colorado specifically. And if you do, again, have a question, either English or in Spanish for our guest today, please email me at chris.bianchi@9news.com, and I will make sure that it is answered. But that will do it for this week's look at COVID-19 in the Hispanic community here in Colorado. Gracias a todos. Thanks to everyone, and we'll see you again right back here next week. Thanks again.
Thank you, Chris. Thank you, Vanessa.
Thank you.